Welcome to SLP Nerdcast. I'm Kate.
And I'm Amy, and we appreciate you tuning in. In our podcast, we review and provide commentary on resources, literature, and we discuss issues related to the field of speech-language pathology.
You can use this podcast for ASHA CEUs. Visit our website for other courses, including live courses, webinars, blog posts, and SLP Masterclasses available for graduate level credit. SLP Nerdcast is committed to improving continuing education in our field through affordable pricing and open access libraries. You can support our work by leaving a review, referring a friend, making a one-time contribution on our website, or subscribing. You can subscribe for as low as $7 a month and get access to monthly Q&A sessions, exclusive content, discounts, and a resource library of downloads, freebies, and printables. Want unlimited access to ASHA CEU courses? There's an affordable subscription for that too. For more information, visit us on our website or contact us anytime on Facebook, Instagram, or at info@slpnerdcast.com. We love hearing from our listeners, and we can't wait to connect with you.
And just a quick disclaimer, the contents of this episode are not meant to replace clinical advice. SLP Nerdcast, its hosts, and guests do not represent or endorse specific products or procedures mentioned during our episodes unless otherwise stated. We are not PhDs, but we do research our material. We do our best to provide a thorough review and a fair representation of each topic that we tackle. That being said, it's always likely that there's an article that we've missed or another perspective that we haven't shared. If you have something to add to the conversation, please email us. We love hearing from our listeners.
We are so excited for today's episode. We are going to cover a topic that we have covered before, but today we get to welcome a guest who has this in their area of expertise and is going to teach us so much. Welcome, Krista Covell-Pearson.
Thank you. It's great to be here. Thanks for inviting me.
Thank you for joining us. And Krista, you're here to discuss private practice, which is an area I know just a smidge over nothing about. Before we get started, can you please tell us a little bit about yourself?
Yeah. My name is Krista. You already said that. I live in Colorado, born and raised, and I've been an occupational therapist for 20 years, which I always remember meeting people that would say that, and I'd be like, that's never going to be me, but it's me now. And I've had a private practice for about 14 years, and we service all of Colorado and Wyoming. And we do mostly older adults, but we do some pediatrics too. And I live in northern Colorado with my husband and 2 3-year-old twins and a 6-month-old baby. So it's very busy. If you hear them, I apologize. Hopefully everybody's following directions and they're not going to bother us.
That's okay. Our young ones and pets and things bother us on the podcast all the time. So
okay, good.
Don't worry
good
about
company.
It. Yes, exactly. Okay. You also do some business coaching in your work. Isn't that right? I know we talked about this leading up to the podcast. I wanted to make sure I mentioned it.
Yeah, I have just come by, honestly, just out of my own personal experience. And when I became somebody in business, I was a therapist through and through. So I didn't know what I was doing at all, but there was really nobody for me to reach out to at the time. There's definitely a lot more resources now for therapists than when I started, which is great. But I do business coaching where people can hire me from across the country, and we can talk about things from if you're just thinking about starting a business, or you're maybe in the first couple of years, or maybe you have an established business and you want to talk about making changes, or all different kinds of things can come up as a business owner. We also offer some business coaching opportunities for specific things like marketing, recruitment, and that is one of my colleagues that works with me at the practice. And then we have somebody there too that specializes in billing, because there's always a ton of questions about billing and insurance credentialing and how do I do it and what does this mean? So that's available as well. But we do that, and it's a very customized thing that people can just hire us for. Exactly, maybe they just want to do 2 hours with me to ask questions. Other people want my support, every 2 weeks. It just depends on what the person is looking for.
Well, as a fellow business owner, I'm very selfishly excited to absorb all of this knowledge, because you're right. As clinicians, we don't get training in this area. And when you go into private practice and you go into business for yourself, you're left with Google and maybe some bad advice from other colleagues or people in other industries who don't quite understand the nuance of billing and funding and marketing and some of all of these things in the healthcare space, which is such a niche, but we're like a niche within a niche, it's not just healthcare. It's, it's interventions, it's supports, it's rehab, all those kinds of things. So I'm really excited selfishly to have this conversation. And before we get into the learning objectives, I also wanted to mention that you've been incredibly generous and offered to do a Q&A as part of this podcast for our subscribers. So for those of you who are listening, we offer a monthly Q&A to our subscribers. It's the first Tuesday of every month at 4:30 p.m. Eastern Standard Time. And we record it for our members who aren't able to attend, so people can come and ask questions live. So if you're a subscriber and you're interested, stay tuned for an announcement on a specific date coming up. You can find that date out through our email and our social media channels. And Krista, thank you so much for being so generous with your time for that. And I can't wait to pepper you with all the questions more after we're done with this conversation.
No, absolutely. And one of the things I love to do is help other therapists become successful in business, because the more of us that are successful, the easier it's going to be for everybody, and the more people we can reach and make an impact with. So if I have a nugget of information that I can give to somebody else, I am more than happy to do that, because I've had people do the same thing for me. So I'm excited that you've included me in this and the Q&A. It'll be fun.
Well, like I said, selfishly motivated. So I'm excited to learn from you. It's going to be
pressure.
Great. Exactly right. Okay. So first, before we get into it, I have to read learning objectives and disclosures. For those of you who write in and ask me to skip this part, I can't. Asha makes me read it. So we will try to get through it as quickly as possible. Learning objectives. Learning objective number 1, participants will be able to identify 3 marketing strategies used in private practice. Learning objective number 2, participants will be able to identify 2 strategies for maintaining Hipaa compliance in private practice. Learning objective number 3, describe benefits and limitations of both private pay and insurance funding. And learning objective number 4, participants will be able to describe the importance of personal development in private practice. Disclosures, Krista Covell Pearson's financial disclosures. Krista is the owner of Covell Care and Rehabilitation that offers rehabilitative services and business coaching for private practices, billing, and business development. Krista Covell Pearson's non-financial disclosures. Krista has no non-financial relationships to disclose. Kate, that's me, my financial disclosures. I'm the owner and founder of Grand Bois Therapy and Consulting, LLC, and co-founder of SLP Nerdcast. My non-financial disclosures, I'm a member of ASHA SIG 12 and serve on the AAC Advisory Group for Massachusetts Advocates for Children. I'm also a member of the Berkshire Association for Behavior Analysis and Therapy, Mass ABA, the Association for Behavior Analysis International, and the corresponding Speech Pathology and Applied Behavior Analysis Special Interest Group.
Amy's financial disclosures. I am an employee of a public school system and I receive compensation as co-founder of SLP Nerdcast. And my non-financial disclosures are that I'm a member of ASHA SIG 12 and I also serve on the AAC Advisory Group for Massachusetts Advocates for Children. All right, we've made it. The dull bits are done. Krista, why don't you start us off by talking to us a bit about the basics? What is marketing and why is marketing so important when you're opening or running a private practice?
Sure. Marketing is hugely important. And when I first started in private practice, I had worked as an OT in skilled nursing and home care and a couple different settings, hospital settings and stuff. And I actually had also worked as the director of marketing for a skilled nursing facility. And that was sort of a weird thing that came about. I wanted to be in rehab, but there were no jobs available. And so I took the social work position. And then, I was really young, and this older gentleman that worked high up in corporate with his big suit on, who kind of intimidated me, was like, you should be the marketer. And I think he just saw somebody that was eager to learn, not afraid, but pretty naive about going out and like just talking to people. I didn't think it was a big deal, And so I think when we talk about marketing, we have different perceptions of what we think that is. And I said to that gentleman, well, that sounds great. I'll do the job, director of marketing. What's marketing? And he looked at me and was like, maybe I made a mistake, but then he ended up training me on marketing of all different types. So you can look at things from online marketing, you can do magazine articles, you can do radio shows, you can do networking events, whatever it is that you're going to be marketing your services, your name, your company, your product, you have to get it out there. And we spend a lot of times doing the things that we know how to do. And as therapists, or maybe product development, depending on where the therapist focus is, we're really good at those things. We're not always great about getting that information out to the general public or to other professionals in a way that they can understand. So it's growing that arm of your business, it can feel really uncomfortable, like you're wearing somebody else's clothes. It's like, this doesn't feel like me. But it's really important in order to get your business to actually become a business and pay you. Otherwise, it's really just a hobby. And that's where marketing can make the difference between a successful business and a non-successful business. So that's really where somebody has to start.
So this was one of my first lessons in private practice. And I learned this from my husband, who works in business and is sort of always, hi, Gil, I love you. You're a wonderful human being. But he's always sort of yelling at me and giving me the critical feedback that I need and reminding me that you don't have a business without a customer. And I get so distracted by what he calls the shiny penny. So business cards, a website, all of these bells and whistles, but you don't have a business without a customer. And I have learned that you don't have a customer unless you have put it to market, unless you have basically told people that you exist.
Yeah. And that's sometimes the scariest piece, because it's like we have this big idea of, well, this is my company and it's going to be so awesome and it's so important. And look at these, people I've helped at my regular job. And now I'm going to go out into the world and I'm going to do this. But we don't really want to go out in the world because it's scary. We don't want to have our dreams and things crushed because it's, we have to tell people what we're all about. And somebody might say, well, we don't need that. We don't like that. You don't know what you're doing. I've been there. And even in the beginning, because we're a mobile outpatient practice, that really didn't exist when I was first starting out, except for maybe a few sprinklings across the country. And I, for years, had people ask me like, oh, well, what you're doing really isn't legal. And I was like, really? Okay, well, maybe you're not my people. But it's like, I'm not going to market to you, or I'm going to market to you a lot and change your mind. But it's exactly that. You can't get any forward momentum if you're not doing marketing. And it's really easy to get caught by that shiny penny. I went to a mastermind group, and Kate, I think I shared this with you, but we were all different industries. And one of the ladies that was in the group with me had started an event planning business. And she's awesome. I've known her for years. She had left the nonprofit industry and she started this company. She had reprinted her business cards because the pineapple wasn't quite in the center. She had this lovely website that she had spent thousands of dollars on and all this stuff. And then I said, well, that's awesome. How many clients are you seeing a month? And she's like, well, none. And I was, what? And she said, I really, I haven't really started marketing yet. And I'm like, oh my gosh, you're already like $5,000 in the hole. Mm-hmm. And so she eventually actually never got her business off the ground, and she went back to her regular job. And a big piece of that was because she just did not feel comfortable doing the marketing piece and didn't. And I see a lot of therapists get bogged down on what their practice is going to look like someday. And it's a dream, but you have to get out there and do the hustle.
And I also want to say that, for a lot of us, doing the marketing, we think of it as like a gross salesy kind of experience, right? And we're clinicians. We're not necessarily trained to be putting ourselves out there in that capacity. And it does have a bit of a public feel to it. So I have learned that it doesn't have to be that way. It can be still uncomfortable and very much outside your comfort zone, but can still be done and be effective without feeling so uncomfortable that you never want to do it again. And I'm wondering if you could walk us through some strategies that, just thinking about our first learning objective, what strategies have you used or would you recommend that you find are successful for people who are starting a practice?
Yeah, I'm happy to go through some of those. And before I do that, I do want to say this sort of changed my perspective about marketing a little bit, because I felt that way too, that I was too salesy or too pushy, or people were too busy for me. But this is what changed for me, is when I had a paradigm shift that people need this information, because if they don't have it, they can't make the best decision for their loved one. And that changed things. So then I literally walked by somebody at Pumpkin Patch yesterday, and I overheard her say to her friend, I wish our occupational therapist didn't do just exercises and stuff, but I don't think we need OT because I can exercise all the time. And I looked at my husband and he was like, oh, great. And I was like, attack that girl. She doesn't know what we can really do. So there's just that time that we're doing like a public service, and there's lots of different ways to do that and get good information out there about how to help people. So some of the things that I recommend, and people have to weigh out the pros and cons of each one based on what their market is. And if you need to figure out who your market is, then who are your clients, but also who's your referral source. So for me, in the beginning, especially we're older adults, a lot of my older adult clients had dementia. So they were my client, but not really the best person to market to, because they're not going to remember me in 5 minutes. And so their spouses, their adult children, their physicians, their neurologists, that was more where I needed to spend some of my marketing time. So figuring out that client versus referral source is also important. If you're online a lot, then you do want to develop that online platform. If you are in your community, like I am, you got to get off the computer, and people get really stuck in the computer and, sending emails. We do it all the time, but you got to get up and you got to go out into the world. And one of the best ways to do that, to start out, is just volunteer. You can find a bazillion different organizations that are looking for volunteers. Find something you're interested in, find something that might connect you to people that you want to meet, whether it's physicians, or maybe you want to go see what's happening with Rotary, because a lot of older adults are there and maybe they have friends and neighbors and family members that need to talk to you. But get involved. And volunteering is really fun. It's a way to give back. And then you're going to learn a little bit more about your community and your organizations that you work with when you go behind the scenes as a volunteer too. So there's a little bit of strategy there. But it's a great way for people to get to know who you are and what your heart is, and just get out there and volunteer. So I've done, I don't even know, thousands of hours of volunteership. And then eventually you can take on more leadership roles in those volunteer organizations too, and then grow your skill set in that way, which definitely benefits your business. I definitely recommend joining your state board. I was the OT Association of Colorado's president for a couple of years. Learned more than I ever thought I could ever learn by serving on the board. And I never in a million years thought I would do that. But I learned a lot, with the lobbying piece, getting involved in that way, which is definitely helpful for my company, because I want to know if our types of services are on the chopping block, and I can advocate for that. And then me becoming a little bit more of a leader then draws other therapists to the company to also want to work with us, which is helpful. And then they also can help us with networking and marketing. Giving presentations, this is a big one, to other companies like therapy teams, home health agencies. That's huge. So figure out what you do and what you do well. So for example, I am board certified in pelvic muscle dysfunction. And if you would ever told me that I'm like going into people's, groups that are total strangers to me, and I'm like, let me talk about pee and poop and, your rectum and all this other stuff. I mean, people are like, I would
5 years old. You can't say rectum and not expect some sort of a giggle. I'm just saying.
I know. And that's how I felt for the longest time. But then I got really, passionate about it. And people started raising their hand in the group saying, well, I've got this going on. And sometimes even then I was like, it's a little much for me, but it works, and then you also stand out as a leader. And even if you're not board certified in something, even if you're a speech therapist, a general practitioner, guess what? You are extremely skilled. You might compare yourself to somebody that, they've been in the business a bazillion years, this, that, and the other thing. You have a skill set in your back pocket, very highly educated people. So go out there and do some marketing in that way. Do you want me to keep going? I have some more to talk about too.
Yeah. And I had one question. I wondered about the power of screening. So I've seen some practices in our area offer free screenings for preschools, which is a great referral source, but also doing a service to your community as well. When you talked about volunteering, it's sort of, it's a free service that you're giving, but you're also establishing yourself as a resource in the community for people who may need your services.
Yeah. And I can testify to that for sure. So we did, let's say it was last week, we did 2 screenings, one for the hospital. We did some balance screenings. And then we did another one at an independent living facility and did balance and fall screenings. And we walked away with 8 referrals from one group and 6 from the other. I mean, that's awesome.
And when you're trying to coordinate these relationships with the community where you're setting up these screenings, what are some techniques that you have used or some strategies that you've used to form that relationship initially with the setting and maintain it over time?
Yeah, so that's a great question. And I don't think there's like a big science to it, but there's this: be genuine, be consistent, be kind, and continue to educate. People are very busy. We all are, and we forget about things. So if somebody said, that sounds like a great idea, let's set it up next month, and then they don't call you and you think, oh, what a flake. No, go back, and just make that call. Say, hey, it's me again. Don't mean to bug you, but we talked about this next month. Can we set it up for the 5th? And just to keep coming back to it. And I don't give up on people. I mean, if they're obviously, you have to go with your gut. I mean, if you know when you're getting the cold shoulder, don't be irritating.
Right. Don't be that one.
Yeah. But to be honest, and you can even tell people, say, hey, we're looking to grow our business, and we think that we could offer some screenings to your organization, maybe one time or maybe monthly. And a lot of times people are also looking to kind of beef up what they can do or what they can offer. And that independent living facility that we were at, they're always looking for ways to tell families, that we're here, we're independent living, but we're also here trying to look out for your older adult loved one. And, Covell Care is here doing fall prevention screenings every month, and we can sign up your mom before she even moves in, blah, blah, blah. So they're jazzed about it too, because it makes them look good. And really, if you can get to the point where when you're marketing with people, if you know them by their first name and you feel like you could, not even that you will, but that you feel like you could ask them to go get a cup of coffee with you and it wouldn't be weird, that's when you're kind of on the in. And maybe you don't even like that person at all, but that doesn't matter. You just want to have a good, solid relationship with people. So that's
I was just about to say that exact sentence. That
really?
Is such a good barometer for so many things. I love that.
Yeah. Because you don't want, you wouldn't just be like, hey, stranger, want to go to coffee? They'd be like, no, I don't. Yeah. I don't know you. But if you're like, able to joke around, about their family, or, look for things too. If they have, a new, cast on their arm, ask them what happened, or talk to them, get to know them. It's just like your patients. You want to get to know them on a personal level because you want to work together. Mm-hmm. And same thing if you work in a team in a skilled nursing facility or a hospital, you're going to get to know your colleagues. Don't let those barriers of the fact that they work for other organizations get in your way of growing great friendships, truly friendships with people in your communities.
I think that's a great suggestion. And I'm wondering, did you have other ones that you wanted to say?
Yeah, I have a handful. So one place too that is out and about a lot in the world are home care agencies. And you can do that for peds, you can do that for adults. And there's all different types of home care. So you've got your skilled home care and your non-medical home care. They're going to want different things from you depending on what you provide. But if you can give them tools that they can use in the field and do an in-service in that way too, and then always tell people how they can interface with you, or ask them, what is the best way that we can interface with your organization? How do we make referrals to you? Because you're also building your toolbox. So you're the best practitioner in your community to make recommendations. Like, I know there's a skilled nursing facility in Fort Collins. I'm not going to steer people towards that one. I'm going to steer people towards ones that I know with confidence that are doing a good job, but I don't know that unless I'm in it. So go out and meet those home care agencies and find out who's doing what. And then you'll find people that have specialties in those organizations that can benefit the patients that you have as well. You brought up a great thing about screenings. So your local hospitals, you can look at anything like that they can offer. Sometimes like ours has something called the Aspen Club. You can get involved with them. That's all older adults. It's a membership base, but they have tens of thousands of people. And you can ask them, hey, could we come in and present to you? Could we do some clinics? And again, they may say no. And there's a lot of red tape around those big organizations, but just get to know those organizations more and more. And I can tell you, we just kind of stuck with it, met some people at the hospital here and there. We still maintain those same relationships 14 years later. And now we're actually in their computer system at the hospital, in the emergency room. So if somebody has a fall and comes to the ER, we're buried in there somewhere that the ER doctor can make a recommendation to us. But we wouldn't have gotten there if we didn't just kind of follow those breadcrumbs. And even though it wasn't like the first time we went to them, they were like, come in and do a clinic. We'll give you 15 referrals. They just, we just kind of were like, well, what do you do? This is what we do. And we kept that relationship going. So reach out to your hospitals. I like to say, make a chicken list and make a list
more about this.
Yeah. The chicken list is make a list of 100 people and then look at that and think, who's the most intimidating? Call those people first.
Oh no, don't call them at all. That's scary.
Right? Yeah. We have a big hospital up here. They have they're like the rehab team that's like, we are the best rehab professionals. And I'm like, I can't call them. Once I called them, I'm like, they're just like me, and we became friends and stuff. But oh man, I mean, I was like sweating to call them. I was nervous. And
I'm nervous
now,
for you. I don't want to call the people on my chicken list.
Right. But make a chicken list. And even if you just chip away at it. But interestingly, now the rehab director that was there for years and years, now she works for me. So there you go.
There you go.
What's going to happen.
There you go.
Organizing events in your community. Again, this goes along with volunteering, but maybe make it a little more skilled depending on what you can do. Maybe it's, you can just say, we're going to set up our own group event. We did a big Tai Chi class in the park and started inviting people to come, after COVID started opening back up. Sending report cards to physicians. That's a good one too. They get a lot of paperwork. So get permission from your patients and their families, take some pictures, get you in there, show the before and after, say, even if you can't see it, take a picture before, and then, you guys all smiling together at the end, saying these are the successes we've had, because stories paint a beautiful picture and everybody wants to see their patients doing well. And that gets through to the physicians a little bit better than sometimes just another report. I can't even imagine how much paperwork they have to sign off on.
I love that idea, because you're right. A picture, a story paints, what's the expression? I think it's a picture
or something.
Right.
Yeah.
But the storytelling component, we are working in therapy and rehab. These are human experiences. Mm-hmm. So being able to share the human experiences that you've had with your patients or clients, I think is a great thing to highlight.
Yeah. And when you're presenting, share those stories, because there'll be people out there in the world that are going to say, that sounds like me, or that sounds like something I'd want to be part of, instead of just saying there's 74,000 people in the country that have this disorder. That's just less relatable. But the other thing I was going to say too is reach out to specialists too, like neurologists and psychologists, because we tend to think of PCPs as where we're going to go. But if you've been in healthcare for a nanosecond, that everybody's got this special doctor and that special doctor doesn't talk to this doctor. So make sure you're reaching out to those folks. I noticed that they don't get quite as inundated as the PCPs. So I think that's important. And then reaching out to support groups. That's another big one, and talking to them and coming in maybe once a month. You can offer things, you can drop stuff off for them, or you can take it one step further and be a support group facilitator. I did that for 3 years, I think, at the Alzheimer's Association. And it was once a month and it was at night. It was humbling, to say the least. And it challenged me as a therapist in so many ways, because the people that were coming were telling me things that I was like, this is like the really hard stuff. Mm-hmm. But it kept me in check with what people were really going through at home, instead of just coming in as an OT sometimes and seeing a snapshot of things, but just the grief that went with it and the problem solving. And sometimes literally, as a therapist, being like, I got nothing. I don't know what to tell you to do. And so that was really helpful too. And, made great contacts there. And then again, families get to trust you. So they want you to come out and see your loved ones. But those are some of the strategies that I have for marketing that don't have anything to do with like going out and putting up a billboard. You can still do that stuff, but this is a little more boots on the ground.
I feel like a lot of the things that you've talked about related to marketing also have a lot of benefit as a clinician, and probably also as a business owner. They sound like a lot of these things are personal challenge and growth areas, right? Like, call the scary people, get a better appreciation of, what your clients or their caregivers are experiencing. Like, all of these pieces are not only challenging in one way, they're stretching you in a couple of different ways that can have payoff across like multiple domains.
Yeah. Not only that, but what resonated with me about a lot of what you were saying is how relationship focused this is. And I think that benefits you in a variety of ways as well. So not only, like Amy's saying, does it inform you as a human and as a clinician, but also what I've learned is people buy things from companies and other people that they know, like, and trust. So if you don't have a relationship with someone where they know you, they like you, and they trust you, or you've established yourself as a content expert, or maybe, at least a specialist, even if you're general practice, I'm using that term as you obviously have a master's degree in something, then, they may not send you those referrals. I think the cornerstone of what you're saying being relationships is so important, and something that we don't think of. We think of like paid ads on Facebook or the website,
And the interesting thing about therapists, that's what we're good at. We are relational. We know how to ask the questions. We know how to talk to the crabby people. We know all that stuff. It's what we do. So if you look at it as it really is going out and assessing your community, who needs speech therapy? Who needs this? Who needs me? It's much different. Whereas even when I talk to the people that market Coval Care, when they're non-clinical, they have a different approach. It's, we'd like to donate and have our plaque put up with a Christmas tree. And I'm like, yeah, that's great. Where's the people? And so I'm like, is that really it's important. You want people to recognize your logo and your name. But as therapists, we really are marketing by doing what we do, and that's connecting with other people. So if you think about it that way too, you have more marketing skills than you probably think you do in the beginning.
It's just like ripping off that uncomfortable chicken list Band-Aid.
Yeah, chicken list Band-Aid.
Self-promotion or what have you. But there's a whole other side to this private practice bit too, right? Because in addition to being a business, we're talking about being an allied healthcare business. And when we talk about healthcare, we need to talk about Hipaa and all of those rules that go along with it. So I wonder if we could move into our second learning objective and just talk a little bit about that and the Hipaa compliance piece.
Yeah. So this is where some therapists then kind of are like, you lost me there. Like, I'm not interested. It's just too much.
I'm pointing right at myself right now.
Honestly, it's me too, but it is a necessity, like you said, and you do have to look at all these different pieces of having a business and learn it. I think we tend to think we know about things because we've been told about it from other employers or even our own experience. We've all signed a Hipaa thing when we go to the doctor, and we don't read it. But you don't know. So this is what I recommend for all practitioners that have to comply with Hipaa. And if you are billing insurance, then you have to comply with Hipaa. My personal recommendation is, even if you're not doing anything with insurance, I would just go on the safe side and follow the Hipaa guidelines. They're there to protect people, and there's really nothing wrong with that. Is a little bit of a pain, sure, but it is just kind of the way it is now. So it's better to just get over the fact that you may not want to do it and just do it anyway. So it's just, you're protecting your patients' identities, and that's an important piece of that. And we have to remember too that with Hipaa, it's not just that, Krista Covell Pearson is what you're protecting and maybe my birthday. It's, you can't be sitting in a coffee shop together like Amy and Kate sitting around saying, I just saw that patient earlier and she's really struggling because her mom passed away from, Lou Gehrig's disease, and then she had to put her poodle down. You've just given identifying information out at a coffee shop, and we can't do that. And I think people forget, like, oh yeah, that does identify people. Because if her daughter was sitting at the next table, she would probably be like, are you talking about my family member? So we have to just remember that that's what we need to do. So in order to be Hipaa compliant for all practitioners, I recommend start at Hipaa 101. Even if you feel like you know what it is, take a class. There's great webinars about it, but go to a reputable source. Don't go to your Facebook groups and ask. You need to find out what the laws are, and you need to learn them. And that goes for lots of things, but I would recommend taking a Hipaa class even annually if you can, and definitely every other year. because laws change, rules change. And if you don't know about it, you're not going to be compliant and you could really get yourself in some hot water. So that's where I would start with the education piece. And then as you're building your business or combing over your business, you just have to remember that everything about your business has to be HIPAA compliant. So for example, like who are some professionals that you might work with in your businesses that aren't speech therapists?
You mean that are employed within the business?
Yeah. Or maybe contractors you use for different things. Like maybe a
billing
CPA.
person.
Yeah, a billing person, your CPA, somebody that does payroll, maybe your website designer. And what we know is they may see some HIPAA information and then all of a sudden they need to be HIPAA compliant as well. So there's something called a business associate agreement and they have to sign that. So you have to make sure that you have that. So if you have a fax machine that's virtual, your Google or whatever you use, everything has to be HIPAA compliant. And if you don't have that BAA, you can't really get their buy-in to say, yes, we are HIPAA compliant with your stuff as well. So those BAAs are important. If you've never heard about that, don't worry. I think that's the other thing. Private practice therapists are always like, oh my God, like I've been in back practice 5 years. I don't have any of that. It's like, it's okay. Just start. And so plug it into Google. It'll come up. There's lots of forms out there that you can get where you can sign it. The other person signs it. It's a pretty simple thing to do, but that's important to have those on file and get those updated every once in a while because the requirements for the BAAs do change. So some things that you have to think about, like I mentioned, the fax, the email, if you're using EMR, any billing software that you use, your landlord potentially, your CPA, any contractors, anything like that. Everybody has to be HIPAA compliant if they're tethered to you in any way.
I think that's great advice. I think this is one of the areas of private practice that's very intimidating because, like you said, you could get in hot water. And when I say hot water, I mean like, you could get sued. You could lose your business. You could lose an asset, the personal asset. I mean, there's a heavy risk there. And another thing that we don't necessarily get educated on in graduate school. We leave graduate school knowing that patient privacy is important. We leave graduate school knowing that HIPAA is a thing. Yeah. But when you're working in most work settings, you get to pass the buck to your supervisor. You're covered under the entity of your employer. But when you are the employer or you become an entity on your own, the buck stops there. I mean, you have to know these things. It's so important.
And then in addition to doing your education every year, it's also important that a business owner does an audit on their business every year. So you look at things and you're going to maybe mark it as a tiered system. So for example, I'll look at things at Coval Care and I'll say, okay, email, are we HIPAA compliant here? And then as we got bigger, even though we had the HIPAA compliance agreement and everything like that with Google, I thought, you know what, we're going to take this a little step further. And we added something called PABOX, which further encrypts our emails going in or out. And, just because our risk became bigger as we got bigger. So it's important to look at those things. And then like text messages, we had to convert over to a HIPAA compliant app or make sure when telehealth came out, especially got so big with COVID, we had to make sure everybody was using a compliant telehealth program. So those are the things that you just go through. And, maybe it is a moderate risk. So you have minimal risk, like no risk, minimal risk, really nothing's no risk. I mean, let's be honest, but minimal, moderate, and high risk. Anything that's in high risk, get that down to at least moderate. Then when it gets into moderate, weigh out what those risks look like. And then if you say, we scored this as a moderate risk, and this is why, it also shows somebody that is maybe auditing you later if you got in trouble for something with HIPAA or you need to present something, that it shows that you weren't just lackadaisical with the whole thing, but that there was a rationale behind it. So keep track of those things and do it every year. I do it and it usually takes me a couple of days.
I love that suggestion. I know that there are, everybody's personal threshold of risk is very different. So some people are really comfortable with high levels of risk. It's fine. It's never going to happen to me. I'm not going to get sued. Other people, myself and Amy, are very risk averse and don't like any of them. And then there's everything in between. But I love your suggestion of at least documenting the fact that you've acknowledged the risk and what steps you've gone through to mediate
Yeah.
those risks and how important just that one step is. So even if you feel like you have a high risk tolerance and you're comfortable with X, Y, or Z decisions that you've made, I still think it's a critical step to evaluate those things on paper, create permanent products that are related to them, and a paper trail for your thought process so that you can show that you acknowledge the risk and that you're not, as you said, what did you say? Lackadaisical, willy-nilly. You're just not, you're not just like not caring and just going about your business, flaunting it everywhere.
Yeah. Yeah. And taking that class also shows too that you, that you care, that you're interested.
I think there must be a piece that sort of spins off of this, depending on the size of your business too, that addresses your how you manage your employees and how you make sure that you're not the only person who's aware of these rules. You're not the only one who knows not to have that conversation in the coffee shop, but everybody knows it, and you have a plan to make sure that everybody knows it. But yeah, there are a lot of different moving parts. And I'd imagine it depends on the type of business that you're doing as well. Are you in a facility and you've rented a space and you're doing a lot of direct service? Are you doing mostly remote service? Are you leasing a space somewhere? So all of those variables in terms of like how you're storing your files and what that looks like.
And you have to talk about what happens in an emergency situation. So if you're mobile like me and you leave your computer in your car and your car gets stolen, what? Oh, no, it's bad news. But if you have a policy in place that you hope people will follow, that you never leave your computer in your car ever. You take it in with you, or you carry it in your bag if you've got to stop at Target. That's what we tell people. I did have an employee once that literally at the facility that we work at, she just left her computer in the family room. She went to go talk to a patient and left it there. And then somebody moved it. So it shouldn't have been left there. And she freaked out. Luckily, it was just placed like next to the couch, and everything needs to be password protected. So that's another thing, but it could have been a really bad deal. And luckily for us, it wasn't, but it was literally a mistake. And those things happen. So then you have to know that mistakes do happen. What's your plan if you have a privacy breach? So if somebody would have taken her computer, what do we do? Who do we notify, and how do we notify them, and who needs to be how do we call the clients? How do we tell them that it is protected or it is at risk or things like that? So, and it's really easy to go in the rabbit hole, and it makes people get really afraid.
This is why I can't. I have no tolerance. It's so terrifying. But
it is. It all is. And then when you talk about insurance and all the horrible things can happen. But if you put those pieces in place, and then every year you're going to be going over that again, it's going to get better and better and better. So, we hear about some of the most secure agencies in the world having breaches. It does happen. So you have to be smart.
Yeah. If it can happen to the credit agency,
yeah,
it happen to any of us.
Right. So you just want to do your best and then have a plan in place. Like, what would you do if? And sometimes it's just sort of like a conversation, like who could freak each other out more? Say, like, well, what would you do if this happened to you? And it's like, be like, oh my God, I never thought about that. But it just gets the wheels turning a little bit so you can put some safety measures in place.
So now that we've talked, I'm just thinking about people who are listening. Presumably they're interested in, they're learning more about this. They know how to talk to people, create relationships for marketing. They have a to-do list in front of them to make sure that they're compliant. But again, you don't have a business without a customer, and you don't have a business without, because we're in healthcare, funding for that customer. So I want to spend the next couple of minutes unpacking the cost and benefit of private pay and insurance funding. In my practice, I've done both. And I know that there are this is a very commonly asked question, because a lot of people feel like they have to have insurance, and that comes with this whole additional burden of paperwork and billing and knowing the codes. And it's like a whole other world. And I'd love to talk a little bit more about that, because this is another burden that clinicians feel that they have to carry when they're thinking about opening a practice that can be really intimidating and sort of a non-starter.
Mm-hmm. Yeah. And it is a really tough question. I think everybody leans toward, I'll do private pay, because it's just like, then that whole crazy box of insurance, I don't have to deal with. And then you kind of have to weigh those things out. So with private pay, yes, you get to set your own fees, but they do need to be, reasonable. And the drawback though with private pay is there are some clients that you won't be able to take either because they don't have the funding themselves to pay for private pay, or you're just not going to have access to them at all because they're only going to go to people that are their providers. So you might be dealing with maybe a smaller amount of people in the beginning. You can certainly grow that, but you're not going to be able to kind of go around and say, okay, well, you're Blue Cross Blue Shield and you're Anthem and this and that. Like, you're going to just start with those private pay people. So it's a smaller amount of people, but maybe that's fine. And you don't want to deal with all the other stuff. So there's that piece of things. The part where it gets a little sticky, depending on where you work and what you do. So for example, I'm a Medicare provider. I take Medicaid too. So for Medicare, let's say I never became a Medicare contractor. So I'm on my own and I meet somebody, they're 70 years old. They say, I want to pay you privately for my services. Okay. There are some legal issues that come around that they actually have to be presented with the opportunity to go to a Medicare provider. So there's just a lot of, you can't just be like, well, I don't do anything like that. So you're still going to have to keep notes as if you're a Medicare provider. You're still going to have to give them the opportunity to bill. So guess what? Now you're generating a bill for them. You're not submitting it, they are, but it can create kind of a headache. So there are things that you need to investigate about the insurances, and different states have different stipulations around their Medicaid programs too, that at least educate yourself on those things first so that you can give patients the correct information. Because you can't say, oh, sorry, I'm not going to give you a bill. You have to. So there's some things around that can be kind of tough. When it comes to insurance, of course, then if somebody just looks on their list of providers and it says Covell Care and Rehab, maybe they'll just call because we're an in-network with their provider. But I think just for folks that might be on the call that may not really even understand like the Medicare, Medicaid difference, do you want me to just cover that?
Yeah, sure. That would be really helpful. Yeah.
Because I'm amazed at how many people don't really know, but why would they? Because when you work for somebody else, you don't care. You don't think about it. So Medicare is your big federal program. So everybody in the United States can have access to that. You have to be of a certain age, usually over 65. You have a disability. There's different things that you can tap into Medicare. So it's federal dollars. Then you have Medicaid, and Medicaid is your state funding. So each state gets money from the feds, and then they have money from their state, and then that state can decide how they want to spend that money. So in the state of Colorado, for example, we can do home modifications. So people that have Medicaid and are in a certain program, they get $14,000 a year to modify their house. But if I drive up to Wyoming, they don't have that benefit. So your Medicaid benefits are going to be different state to state. So people have to know that too, because I meet people all the time. They're like, oh, I came from Kentucky. We can do this. I'm like, no, that's in Kentucky, not here. So you've got Medicare is kind of the big dog. And then Medicaid, you've got 50 Medicaid little puppies running around spending money. And picture it that way. And then within Medicare, so I like to tell people it's like a big umbrella, and then underneath are a series of other little umbrellas. And those little umbrellas cover jurisdictions within the United States. So you have all your Medicare rules and regulations. Then, for example, there's Novitas or Noridian. They're big insurance companies. They oversee the states, and they decide, they kind of interpret the Medicare rules and regulations for themselves. They put out the billing manual and their own manual about that you have to follow within your state. And then we answer to that fiscal intermediary. So for example, we just got audited by Medicare, but that actually means that Novitas is auditing us. So that's who we deal with. So if you want to become a Medicare provider, you have to find out who your insurance contract is for your state. And that's who you're going to get credentialed with. And that's the information that you want to read as far as being compliant. That being said, still read the big umbrellas information, then read your fiscal intermediaries information, follow whichever one is more strict. So some rules will be more lenient one way and the other. Always go towards what's more strict. And then you know that you'll satisfy both areas. And then Medicaid will have their own set of billing recommendations and compliance measures you have to follow as well. If you're any sort of geek like me, you kind of like reading it because you're like, oh, interesting. So we can do, 4 wheelchair things, but we could do, it's silly. But once you start reading it, it becomes a lot less jargony. It's pretty simple. You just have to read it. And it's like a playbook. So,
and if you don't want to read it, you can hire Krista to read it for you and explain it to you because it sounds so completely confusing and dry.
Yeah, it's totally dry, but it really is like the playbook. It's like, this is a game. It's not a game, so I don't want to downplay it, but these are the rules we play by, and that's how we get paid. So, with your private pay pieces, it's actually still a good idea to be reading those manuals to see what's being covered or what's not. There's also things, so for example, dry needling with physical therapy, Medicare is not paying for that. It used to. And so then you have to gather private funding from your patients for those pieces. So those are the things that's important to get to know. A lot of times when I talk to therapists about this kind of stuff, I can feel it. I can feel it right now, even to people that aren't even listening yet, that it's like, they're going, maybe private practice isn't for me.
Dread. It's the dread, the dreaded paperwork and billing.
And there's a lot of fear in it. It's very fear-based. And we're always afraid we're going to end up in the orange jumpsuit. And so, like that there's like these fraudulent things.
Nobody wants to go to therapy jail.
Nobody wants to go to therapy jail.
Yeah. And it's a very
or real jail.
Yeah. We just don't want to be locked up at all. Yeah. And it's a very fear-inducing thing for a lot of people. And I can go there too. The more knowledge you have about it, the less scary it becomes because you know it so well. Mm-hmm. And again, you're going to take your Hipaa class every year. I strongly recommend, even if you're not in private practice, if you are a practitioner, you should be taking a billing and documentation class every single year of your career, because a lot of times the documentation, you wrote it. I am an expert witness for a case right now for a hospital representing a therapist. It comes down to her documentation. So it's either going to hang the hospital and her or not. And so that it's really important that you know how to have defensible documentation.
And for anyone listening who is having some uncomfortable nervous feelings, I'm also having those uncomfortable nervous feelings. As you're talking, I'm like, I've never taken a class.
Yeah.
It's terrible. This is a really big deal. And you're absolutely right. Now I'm going to be Googling documentation classes. Do you have one that you recommend?
I do. Actually, if you do Part B, I always recommend taking anything through Rick Gowenda. He's a physical therapist, but he covers OT, PT, and speech. There's a lot of them on, I know Summit does a good job. They have good, reputable people on there. Those are 2 off the top of my head.
I think it's a really interesting perspective because I'm all about professional development. I love learning things. I'm going to conferences. I'm reading stuff. But
you started a continuing education platform, right? Friend.
Here I am on the podcast because I'm really into this. But it's mostly focused on clinical strategies, right? So this is an interesting perspective that in doing that, I'm leaving out this important piece.
Yeah.
And I don't know how many other people are maybe having those same feels right now, but it's an interesting, to kind of add it into the professional development plan that we all have.
Yeah. Because even with the expert witness case, the hospital hired me, but the therapist is on the stand. And so, and talk about scary feels. I get scared for her. And it makes me nervous too, but the more you know about the documentation, because it really is, the insurance companies are who's paying you. So you should probably know what they want to know. Therapists we're really good about documenting what our patients are doing because we're all into the patients. We're not really good about documenting what we do. And that's what we're getting paid for. So it's documenting that skilled level of service and, not necessarily creative writing as far as falsifying things, but to be a good writer so that it's understood about what you're doing and clear. That's what you need is great language.
You clearly know I could pick your brain for another million years. I feel like I could talk about the need for what do I need to do? Really driven by my own anxiety that I'm now doing something wrong. But I'm looking at our learning objectives and our time. And I'm really excited for the last learning objective because I know you and I had a conversation about this when preparing for this episode, and it's very near and dear to my heart and soul. But I think one thing before we move into that, I wanted to ask a question that I get asked a lot and see what your perspective was. I get often asked, how much do you charge? I mean, and not so much by families, but by other clinicians who are interested in getting into private practice. So how you price yourself, how you price your services for your customer. So, and that can be different. You could be working with families. You could be providing trainings to staff. You could be providing mentorship or coaching. You could be being contracted by larger businesses, hospitals, or schools. What advice do you have about how to price your own services?
Good question.
Asking for a friend.
You want to do a market analysis, find out what everybody else is charging, see what the industry standard is. And if it is something that you're providing that normally insurance would cover, there are some ethical things around that too. So if it's normally $100 and insurance will pay for that, you really shouldn't be charging more than about 10 to 15% over that. It's kind of the rule of thumb. Do your market analysis, figure out what's fair and reasonable, and then don't undersell yourself either. So also think about the amount of time that's going to go into your service on the front end and the back end, and quantify that. So put numbers to that. So you may be thinking like, oh, I could charge $100 to go to somebody's house. That's no big deal. But are you doing a lot of prep work on the front end? Are you writing up a big report that's going to take you 3 hours? You need to quantify that and put down an hourly rate that you feel is reasonable and fair. I find that therapists tend to undercharge, but then there's some people out there that I'm like, whoa, like that's crazy. That's a really high rate. But, you're only going to get it if somebody's going to pay it. So if you want to put your shingle out there and say, I'm $500 an hour and nobody comes knocking, you might need to lower that price. I don't know if that's helpful.
No, very.
And just before we move on to the next one, we talked a bit about the next learning objective. We talked a bit about Medicare, Medicaid. Is there a clear contrast between benefits of just being a private pay person? Because I heard you mention that even if you're doing strictly private pay, you should still be aware of all of these other components. You should know about billing. You should know about the fee structure. So do you favor one over the other?
Of being private payer insurance? Yeah, I say take insurance, but I'm super biased. Always have. I shouldn't say always. I took private pay in the beginning, and then people who were paying me were actually other professionals that needed my expertise. So lawyers, neuropsychologists, and then started getting into some stuff with families. And then as I was like, gosh, you have Medicare, Medicare could pay me for this service, and you've paid into Medicare your whole life. I should be a Medicare contractor. So that's why I did it. And I feel like the insurance, it's opened up a lot of doors for me and my practice that we take all these different insurances. I will say this, that the insurances, if you're out of network, this is something to investigate if you're deciding to go in or out of network, especially with some of the big private insurances, not just Medicare. If you're out of network, sometimes then people will have out of network benefits where they'll still pay for some of your services. Somebody might have a higher copay, but you can get all that stuff by calling the insurance company and asking about that individual specific plan, which we do. We do that for all of our patients. We find out what their insurance will cover first before we come out because we don't like surprises. So you can figure that out. Then if you go in network with those people, sometimes your fees that they will pay you will actually go down. So sometimes it makes more sense to stay out of network than go in. So those are good things to ask. And you also want to ask, I think this is a little overwhelming for people, but also ask when people have an insurance plan. So let's just say Anthem. What happens if they also have Medicaid? Because that can change some things too for reimbursement.
Insurance. It's so overwhelming.
It is.
And it loops back to something we haven't really talked about, but also I think a driving question that helps you make decisions is, what is your business goal? So if you're employed full time and you want to go into private practice for some supplemental income and you want to see no more than 3 or 4 patients on the side or clients on the side, then perhaps the volume that insurance would bring you is not necessary and you don't have the time to invest in the paperwork. On the other hand, if you have a business goal of developing a clinic or a brick and mortar or hiring people or doing this full time, I think based on my experience, getting a volume of a full caseload of private pay is going to be very hard and take you a really, really long time. So I think whether or not to make the decision about private pay or insurance can sometimes be really looped back to other variables going on in your life.
Yeah, I think that's great advice.
Thanks. Okay, so maybe that's the perfect awkward segue we needed to get into our last learning objective, which I'm going to read it out loud again for the sake of reminding everyone because it's been a while. This is related to the importance of personal development in private practice. And it's personal development, not necessarily professional development. Mm-hmm. And I can't wait for you to talk to us about this because we had such a great conversation leading up to this episode.
Yeah, this is a big thing for me, and especially with people I coach. I always like to find out really their level of comfort with this too, because we're always looking towards, okay, we need to figure out HIPAA, and we need to figure out marketing, we need to figure out this, because this is what you do for business. And then I'll talk to people and they'll say, well, I'll read one of those books sometime, or I'm going to read that book, and then they don't. But what I've come to learn, and this is just personal experience, is the better I became at life, which is like, I'm not saying I'm like an A+ at life person, but I'm just saying the better I got at certain things, certain skill sets, the better my business became. And so, communication, patience, active listening, finding out what my own insecurities were, any weird things that you have going on, we all have them. We all have this other side of ourselves that needs to be sort of uncovered and worked on. And when you do that, one, you become more empathetic and capable with your people that you're going to be working with. And two, you grow. And when you're growing, you're stronger and you're more capable of managing a business. If you are going into private practice or you have a private practice, you will learn. It will push you in ways that you didn't think that you would ever be pushed, nor that you wanted to be pushed, or that you ever thought you would ever have to do. It is not always fun. I mean, let me tell you, when we got that letter that we were being audited, I was like, okay, this is kicking in some anxiety for me. But, had I gotten that letter 10 years ago, I would have flipped out. So, just to be able to manage your own self is really important. And it'll help you with your personal finances, with your families, your relationships that are outside of work. It's all a really positive thing, but it benefits your business. So I can't say enough about that. So conferences, books, webinars, and some people are really into that anyways, and that's great. But there's, go to your Barnes and Noble and walk through that self-help section and pick something out that speaks to you. It may have nothing to do with business, but read it. It'll help you. There's lots of really awesome stuff out there. I mean, I could give you lots and lots of resources for those types of things.
We would love those resources, and we can list everything in the show notes so that if anyone is listening and biking or driving or running or folding laundry or whatever, all of the resources will be there. They'll also be on our webpage. I also just want to unpack that for a minute because I find it so important from personal experience. And because I think that these, again, components, they have a trickle effect in terms of benefiting your business, benefiting your therapy, benefiting your private personal relationships, benefiting your personal finances. These are things that you're doing to invest in yourself that then have a rippled effect across so many things. Mm-hmm. And the reason why I personally, when we talked about this before leading up to this episode, and it resonated with me so much, and I thought, spend some time thinking about it, it's related to the relationships that you're making in your community. Mm-hmm. If you have employees, it's incredibly important if you have employees. And I feel that it combats something that unfortunately I see a lot, which is this concept of ego. And that's a really big piece when you have a business is, recruiting people for your business, recruiting staff for your business. I have a great business. Look at all these things I do well, but what am I not doing well? Mm-hmm. When should I make a referral to another business? You're not going to be able to answer any of these questions or model really professional humility for your staff if you have ego. And we all have an ego. I mean, it's not anything wrong with it, but knowing how to sit in the discomfort of knowing when you need to grow or when you need to stay silent or when you need to have a difficult conversation. And let me tell you, and you're right, when you're a private practice owner, you are having difficult conversations all the time with patients and families, with staff who might be underperforming or need a little bit more support, with billing agencies, with people who are auditing you. I mean, there is just discomfort everywhere. And if you can't sit in it to grow, then you're not going to succeed.
Mm-hmm. Yeah. And I think when you model good behavior, if you'll say that, I mean, I'm not saying like, right or wrong, like manners. I'm just saying like when you're really self-managing yourself well.
Maturity. It's professional maturity.
It is. Then people recognize that, they see that, and they trust you. And that helps people to feel safe with you because they are. And even with my own staff, sometimes I'll have a staff member that maybe will just be very, very overwhelmed. And, as a boss, that's the last thing I want somebody to feel. And so then it's also being able to come in but instead of like just saying, okay, well, this is how we're going to fix it. It's also learning how to challenge that staff member to, kind of like a guided discovery, like how can she manage it better? Like, here's some skills, here's what we can try, but also help her engage with it too. If I'm not figuring out how to do that as a leader, I'm not going to be able to really support her, and it's just going to keep perpetuating. So there's just a lot of stuff when it comes to, conflict resolution or advocacy and planning things or mastering, the time that you're working. That is really important too. Organization, and then it's a constant refining. It never ends. And, even the anxiety about, Hipaa or billing and stuff, that doesn't really ever go away. I had the same girl that asked that I was talking about earlier about the business cards and didn't get her business off the ground. In the beginning, she asked me, well, when do you stop being so scared? And I was like,
never.
I don't know, because that hasn't happened to me yet. But, it's also, you do get stronger. So things that scared you a year ago or 2 weeks ago, they're not as scary anymore, and you become stronger. So I just think that is a really important piece of it that people don't really see as benefiting the business, when actually that, above everything else, is probably your ace in the hole.
And I want to unpack one last concept before we wrap up, which is something you mentioned about leadership and how this relates to personal development. Mm-hmm. When you are running a practice, even if you don't have employees, you're the boss. You're either in charge of yourself or you're in charge of people who work under you or with you in a collaborative manner. And you can't develop leadership skills with knowledge. Mm-hmm. You can't, with clinical knowledge, you could be a great clinician and have great clinical decision-making skills, but those do not automatically translate to leadership skills. And so much of that comes from having space in I want to say something, really cheesy, like space in your heart, but it's a personal journey. It's a personal, it comes from a personal place to be able to make space for others. And I think a lot of us who maybe graduated and went into jobs, maybe didn't have the best managers or didn't have the best supervisors. I think for some people tends to be this assumption that, oh, my manager is always right and they're the boss and they're making decisions. And that's not what it's about. It's about making space for other people. And you can't do that if you have bees in your bonnet.
Yeah, that's true. Those bees, I know, they'll just sting you.
But does that make sense?
Yeah, it does. And I think that's the thing. And I think people don't realize too, that when they become a business owner, that's when the shift has been made. Like, you're a leader, even if you don't feel like a leader. I was asked to teach a leadership course. And I said, I don't really identify with the word leader. And I thought, that's kind of dumb, because I am a leader. It just seems weird. Like, we don't say it like I'm a leader. Like, who says that? But you are, and people are watching you. People are learning from you, watching from you, and they're either learning what they don't want to do or what they do want to do. And you got to be able to be comfortable in your own skin too, because like you said, with ego, with business, you can get really, egotistical about the whole thing. We all know people like that. And to humble yourself and just know that, every day is a challenge. But being a business owner is no joke. It's tough. It's really tough. And it's not tough in the way that you think it's going to be. Just like marriage. You think it's going to be tough. Well, it's tougher in a different way.
So in our last minute or two, as a closing to sort of close us out, do you have any words of wisdom or words of advice for someone who is listening and maybe thinking about this as their next adventure?
My advice, if somebody thinks this might be their next adventure, is to listen to that it's like a voice or a whisper or a feeling, and to follow it. And sometimes it's fun to lay in bed and just think about what could be, and that's fine, but just follow it to the next right thing. Pick up that next breadcrumb. If you're interested and you want to find out more, learn more. If you're like, maybe I'll be a Medicare contractor, do that. If you're like, yep, I'm ready to do it, just do it. Just keep going, keep moving forward. Because if you get that, and if you have so much fear and anxiety in the way, work on that. Go see a counselor about it. Go see a life coach, hire somebody, call me, read a book about it, because it's a really powerful thing. But you have every single person listening to this, whether they go into private practice or not, has a talent, and we need it in the world. And maybe it's in private practice. And if that's for you, just keep listening to that calling, and then you'll get stronger in it. It won't feel so scary. You won't always feel like you're wearing somebody else's clothes.
It was such great advice. And you brought it full circle with the clothes analogy.
I totally did.
You totally did. That was so lovely. Oh, thank you so much for being here and joining us. You are just a wealth of knowledge. And I learned so much. I know Amy did too. So much. And for anybody listening who wants to learn more, again, Krista has generously agreed to participate in a Q&A with us. Stay tuned for a date. Check our social media channels. Subscribe to our newsletter. If you're interested in attending, it's a Q&A for our subscribers. It's the first Tuesday of every month at 4:30 p.m. Eastern Standard Time. And we hope everybody learned something today. Krista, thank you again so much for joining us.
Well, thank you for having me. It's really fun. And it's fun for me to talk to people that aren't OTs too. So I'm excited to meet more speech therapists. You guys are doing a great service by this podcast. So it's really fun to be part of it. So thank you for inviting me.
Oh, thanks. Thank you so much for joining us in today's episode. As always, you can use this episode for ASHA CEUs. You can also potentially use this episode for other credits depending on the regulations of your governing body. To determine if this episode will count towards professional development in your area of study, please check in with your governing bodies, or you can go to our website, www.slpnerdcast.com. All of the references and information listed throughout the course of the episode will be listed in the show notes. And as always, if you have any questions, please email us at info@slpnerdcast.com. Thank you so much for joining us, and we hope to welcome you back here again soon.